and I do a atuja.
Yɛhwɛ no musa yame adom a ɛda ɔkyena ɔmampani ɛbɛkɔ ɛyɛ mmarahyɛbadwa fie na ɛyɛ state of the nation address no wɔde akɔto dwa.
Sɛdeɛ mampanyi akasa sɛ enkyɛ bia sukuufoɔ bɛfiti aseɛ na ɔmakɔ akɔsua adeɛ no Ghana Health Service ne Ghana Education Service wɔn ɛwɔ nhyehyɛeɛ papa a wɔde agu akwan mu ɛma wɔn.
Na suku yɛ baby atoso no ɛna ɛyɛ ɔsɔafo hwɛ amane bɔ ho ensɛm so odumyafo kwadwo ɔpɔnkroma HM sɛ aban etu anamo sɛ de bɛyɛ suku a wodo nyina no yɛbɔ enuro wɔ hɔ na yɛkɔ ɛde atia yare COVID-19
sɛdeɛ yɛate sɛ ukɔ Canada wɔmanya vaccine ne bi no wɔn ɛkyɛ sɛ wɔn atu wɔn ho asi hɔ ɛkwan bi aso wɔn ɛdi bi ɛbɛma yɛn a ɛno so yɛde ɛbɛma ɔmanfo anasɛ yɛde bɛbɔ ɔmanfo ho ɛban.
Na yɛkɔ ɛyɛ Kutuka International Airport a nkra no ɛkyerɛ mu sɛ sese ne COVID-19 cases no active one no ɛyɛ 191.
Sanso ne yɛkɔ ama hodoɔ so nsɛm a Kenyaman no akyerɛkyerɛfoɔ no sɛ wɔn so wɔn suro sɛ yɛbie school sɛ wɔn nkɔkyerɛ adeɛ ɛna wɔn kyerɛ sɛ da bi adeɛ wɔ deɛ ɛbɔ wɔn ho paa.
Ebeto aso de ni ɛde akyerɛ ɛyɛ ɔman South Africa ɛso so wɔn kyerɛ sɛ me yɛ adom abusu ebesi mu no wɔn so ɛyɛ vaccine no wɔn so wɔn sa bɛka wɔn ɛdeɛ.
Ensem bi ka ho ne de bra mo wakase boy mu midin di Akosua Sarpong menen
Kwabena Antwi Boasiako
afa kase bo no emu ensem enie empanimfo a wonom eda Ghana Health Service na Ghana Education Service ano womo ede hihye papa agu akwam ni nyina eye mampanyi abra enra wode nsem betu dwa se enche bia ye bie school amma efrin kwada totofe wa ekro no womo akọ school afei empanimfo de no so womo so ebekọ enunti womo de hihye papa agu akwam amma Director General Ghana Health Service Dr. Patrick Kuma Abuaje wakache omanfo se obi anka na kuma etu no yem na hihye papa wo.
Enhance our collaboration with the Ghana Education Service and the Ministry of Education. All senior high schools have been mapped to health facilities across the country. A few months ago, we conducted a nationwide assessment to see the condition of infirmaries and clinics and made some national guidelines out of that. And those who do not have are clearly mapped up. And we are also working on upgrading infirmaries to ensure that those who are in school are safe and are able to respond appropriately. The medical screening for all people, all SHS people, will be institutionalized and be done annually. And that will also be including my first day in school for the newly kids who are coming to school, something we need to look at. So the preschool and lower primary will be monitored as well and supported with the using currently existing school health platforms where health workers go to the school, visit, and of course we have them map up to health centers and hospitals where rapid response can take place. Teachers are being oriented on what to identify risk conditions and refer and how to repair. To continue to make the school safe, we will continue providing the masks, institutionalization of wash facilities, and I must say that that is something that we must really take it very seriously. Institutionalization of water and sanitation facilities. We provide them Veronica buckets. Because of the increased hygiene, because of the COVID last year, as has been mentioned, last year Ghana did not record any case of cholera. We also had a significant reduction in all diarrheal diseases, and about under 5 children who have diarrhea reduced by almost a third. And that is something we need to look at. We will continue disinfection of all schools to make the place safer as the school reopens. Most importantly is to abide by the protocols is by ensuring that we do the risk communications. People understand what we are talking about, change their behavior to avoid infection, and that the objective is to encourage especially the children to observe the COVID-19 protocols in a way that are keen to them. You can see that the kindergarten kid may want to have a red or exchange a mask with a friend, etc. These are all things we are working on. We have to make them take responsibility for their own safety and that of their family and friends in an enjoyable and fun way. So we are going to do an exam that will be coming up to ensure that we continue educating, especially the KG and lower primary.
Na Dr. Kuma Abuaje esa to so edit to dwa HM say okọ Kutuka International Airport enso so say no active cases no 191.
We've opened the Kutuka International Airport since the 1st of September. Recorded cases there. As you are aware, we are doing a 2-tier test. You do a PCR negative before travel, and on arrival we test you, and probably that's the only very few countries that are conducting such an exercise. We have so far recorded 741 positives from September when the place was opened. We have been able to discharge about 74% of all those people who tested positive. Currently, 191, which is 26% of the people, are still carrying the virus, and we have been monitoring them. We have so far not reported death from those who tested positive at the Kotoka International Airport. We've so far done about 120,000 tests with a positivity of 6.2%, which is slightly lower than the general average here. But what is interesting is the fact that in the last December, the numbers have been going up over the months. We started seeing an increase in October, November, and December was a major peak. We recorded 46 cases in September, 98 in October, 169 in November, and as at the end of December, we have recorded 393 cases. We are in January. In the very first few days of January, we have recorded 36, which shows that the number of cases that are coming, that would have been imported in the country, is high and would have been cumulatively gone up. So you can see that for the positivity rate, the number who are there has increased from 0.6%, 2% when we started in September to 1.2%, which is a significant increase in the risk of people who are coming in and the disease. So that makes the policy quite useful. We've also realized that those who are supposed to self-isolate, those who are not keeping because they feel they can self-isolate, have not been managing that properly. And so the new guidelines, as was mentioned by the President yesterday, tomorrow all cases will be triaged at the Gan East. And by the triage, we mean that we'll test you, see your health, state of health. Are you sick do you have any other disease? And then based on that, the decision will be made by the clinicians as to what to do. They also instituted a mandatory 7-day isolation in the designated sites, after which you'll be tested, and if you are negative, you are discharged. Even passengers who tested positive at the Kotoka International Airport, because of the high risk on where they are coming from, we continue to follow them up by calls and see, and also advise them that if you see any changes, please report.
Canadian High Commissioner for aye no amana bepiem wo omaimu abra wone oswafo a ohwe amanone nsem so ehia ye ema wo mo ede enkrata ekire se ampa ono ne ayi no nsem a wo ka no bi ene se share vaccines a eno no ye de eba ababeko COVID-19 ne yetimi asoso yade ne so amana kono wo mo etu onhu asiwo se obeboa ye ewa akwenua se nyina so. New Canadian High Commissioner designate to Ghana, His Excellency Kathleen Saba Ekasano, Oshire say, Canada by no any swadi hune so obeboa, na washase COVID-19 vaccines ahodo no, wombeche amana swama ma hodo nyina eso se na ebe ye obi ade bebo no ho bande afri COVID-19 no ehu. Wode nsem we nyina no etu dwa ebre a wode krata ekokọ dan aso ya ehwe amanone ensem so ewo my Ghana mu, efa emu ahodo no a Canada by no ehwe so obetimi aye ede aboa ma COVID-19 ne ko ni nyina no, ebetimi awie yie ede aboa wiase nyina.
COVID pandemic. I wanted to note as well that Canada is, of course, committed to ensuring that access to the COVID-19 vaccine is equitable. We are a major contributor to the COVAX advanced market commitment to purchase doses for low and middle income countries. We've made a 220 million Canadian dollar contribution to that effort. I know that your colleague, the Honourable Minister of Health, is a member of the Gavi board, which is overseeing this initiative. So I look forward to working on that as well to ensure that there is a smooth rollout. On our side in Canada, we are in the early days of rolling out the delivery of the vaccine. It will be a challenge for every country, and to the extent that we can work with you, that we of course will hope to do that.
Onwonya foshele ayokobo twe ena yeso afo hwa ma no nsem so wo my Ghana mu na wakasa ye ekire enioma hodo na ehya hodo no ana Canada aban no ede ebo o my Ghana woni mpuntu esem mu nyina wogidi se Canada aban ne bekoso aboa o my Ghana se na ebe ye a Ghana Beyond Aid ni yebetimi edubotaye no ehu.
I'd like to thank your country for the help that you gave us to reform, transform and renovate our veterinary services in Accra, Tamale, and for us, this is also very important. It's an important area. And also the assistance that you've given us, also giving the Noguchi for towards improving their services of the COVID-19 pandemic. So these are all areas that we are happy that the two countries have engaged in. We know the traditional areas of cooperation, which is energy, agriculture, education, defense, and also to work together to ensure good governance in these countries.
Now, Ghana Health Service Penny Dr. Patrick Kuma Abwaje SA area to Idrebio HM say COVID-19 no oba eye enkramantem hase no ma enkramantem wa eno mhwiri edikan pa.
Ladies and gentlemen, as of the 1st of January, we have recorded 55,220 cases. And we've done about 74,000 tests, which brings it to our 21,512 tests per million population. Our positivity, that is the population who have been positive, is about 8.2%. Unfortunately, we have recorded about 3,658 health workers who have been affected. 54,005 have been discharged so far. We've also unfortunately lost 333 cases, and currently, as of today, the number of active cases, that's the number of people who have carried the virus, is 879. Majority of the active cases, about 52% of them are all in Greater Accra. Currently, all 16 regions and 243 districts have reported cases, leaving about 17 districts that are yet to report a case since the outbreak of the pandemic. We have had the epicare, we've had a lot of confirmed cases, and if you take a look at it, as at November, our cases were higher, but from 7th of December after the election, the number of cases have remained flat and it's actually shown a slight decline compared to the pre-election figures. We are having an average of about 75 cases a day. And that shows in our moving average, that shows that about 75 cases a day on the average are being reported. And that has shown a decline across since the election and even before the election. So far, 5 regions have no active cases, and these are Savannah, Bono, Western North, Northeast, and OT do not have any active cases. 5 regions, Bono East, Upper East, and Upper West have less than 10 cases. And Greater Accra, as I said earlier, has the highest number of cases. In the last few months, most of our cases have come from Accra. That is, starting from September, a significant number of cases have all been in Accra, with the rest of the country being relatively quiet as far as the COVID cases are concerned.
Yeah, that's why Ejina Director General Ghana Health Service Dr. Patrick Kuma Abwaje was signed so hremu say ye ka cholera ya dia afi etwemu 2020 no enya dia wo mo record cholera ya dia bia e wo mam ni nyina no ye COVID-19 see ye wohoro ye nsane protocols na ne edisu ninti. Penny Kwantrefo a woda apomudi adwuma yekuo no ano e wo Ghana mu Dr. Patrick Abwaje na di nsem we nyina no atu edwa ene wo kire se COVID-19 yi ni ti no e ma ye de nhya hodo no agu akwan mu a eboa ma honedie mapanso ekọ enkan ye papa e wo oman bia mu a Ghana yanyi ye hu amfamfiri mu na eno no obetimi aka ne people say enam so a cholera ene diarrhea yare no yan record bi e wo Ghana mu afia etwa mu no enti wo sese Ghana fo ye koso adi ye hu ni na eno no beboa ama yade hu e de afri cholera ene diarrhea yade no ho wa mananso ho am kasa ya de fa cases ahodo eno na beda o Ghana December boso minimum wo mfie bide ni aduonumu a ni nyina no na efri Kotoka International Airport a watch say yenya cases 393 eno no ye positive cases e na afei afufura yewura mu no cases ya bebeda wo mo no eye ba ko 36.
We have so far recorded 741 positives from September when the place was opened. We have been able to discharge about 74% of all those people who tested positive. Currently, 191, which is 26% of the people, are still carrying the virus, and we have been monitoring them. We have so far not reported deaths from those who tested positive at the Kutuka International Airport. We so far done about 120,000 tests with a positivity of 6.2%, which is slightly lower than the general average here. But what is interesting is the fact that in the last December, the numbers have been going up over the months. We started seeing an increase in October, November, and December was a major peak. We recorded 46 cases in September, 98 in October, 169 in November, and as at the end of December, we have recorded 393 cases. We are in January. In the very first few days of January, we have recorded 36, which shows that the number of cases that are coming, that would have been imported in the country, is high and would have been cumulatively gone up.
Openinga see wie born to fa edefa COVID-19 cases no said near my Ghana mudie no airco enyina edechire UTV nsentwefo. As
at the 1st of January, we have recorded 55,220 cases. And we've done about 74,000 tests, which brings it to our 21,512 tests per million population. Our positivity, that is the population who have been positive, is about 8.2%. Unfortunately, we have recorded about 3,658 health workers who have been affected. 54,005 have been discharged so far. We've also unfortunately lost 333 cases, and currently, as of today, the number of active cases, that's the number of people who have carried the virus, is 879. If it comes to the number of deaths, apart from the May, June, July, where we had a peak of deaths because we also had large number of cases, the last few from October, almost all the deaths have come from Greater Accra region, which means that we need to be very careful where we are, especially in Accra, to be able to contain the pandemic.
Yetwaswana yeko eye mashebedwamu na nyam yadma eda ochina enenkra yensa eka ne se mompina na arodan kwa ekufu ado ebeko eye mashebedwafie na a state of the nation address no wodi akokoto eye edwa na odomyanfo oseche mensabunsu ene sentrofo edi eye nkita ho na nchemu a wodi maye ne.
Speaker, the message on the state of the nation to be delivered by the President would happen here in this chamber tomorrow. I indicated that the election of the Speaker in the wee hours of Thursday and the swearing in of the new members of Parliament, the election of deputy speakers will happen in the tent, and the swearing in of members, as well as the election of the deputy speakers, will take place in the chamber in the wee hours of Thursday. We anticipate completed today, and hopefully to allow members to go and take a short rest and come back at 10 to do the swearing in of the President. The swearing in of the President will be in the tent. It's because of what we need to do. Social distancing, the number of heads of state that have been invited, and dignitaries that have been invited. Secondly, this chamber certainly cannot accommodate that. Indeed, even on the election of the Speaker, the swearing in of members, the original idea applying the protocols was going to involve members, about 75 members, being upstairs. We have now had a way of dealing with it. We only have to struggle to accommodate 275 in the main chamber and to allow for a few VIPs to be up there.
Ebusia for yaji aboafo enkrato edikan abasisia.